Welcome, everybody. Thank you for joining us for our October 2025 ACES quarterly event. Today's topic is Centering the Soul and Art for Suicide Awareness. So in this session, we will learn what it means to be an observer of the soul, what suicide awareness is, how the mind and body connect, and take a look into the multiplexes of Black and Brown trans lives and experiences. Most importantly, we will discuss what it means to look at suicide as a multi-area public health matter and how an artistic, philosophical approach provides innovative perspectives. So our speaker today is Remy Styrk, the founder and director of Halogen. Remy is a change agent restoring the ability to dream by approaching philosophy, models of care, and humanness as a syndemic. He is a Black trans man and an award-winning filmmaker, musician, and humanist with over 15 years of working experience, being named one of the 7 of the 2024 Whatcom Young Professionals Top 7 Under 40 awards. Remy has worked with a range of companies, from HBO and Microsoft to high schools, groups, and nonprofits, such as North Sound ACH and the Washington State Syndemic Planning Group, researching how people learn through storytelling, cultural anthropology, creative engagement, and designing custom programs. He founded and led the pilot year of the Omni Center at Northwest Youth Services, an accredited digital media studio for Black, Indigenous, and Brown young people. Remy's work with Halogen is evidence-informed and lived experience-based. We're very excited for this presentation today. If you have any questions in the moment, you can pop those in the chat or the Q&A. If they're larger discussion questions, we will have time allotted at the end and save those until the end. But feel free to pop anything in the chat and I'll be keeping an eye on that. And it's my pleasure to hand it over to Remy Styrk.
Thank you. For some reason, my camera just wants to keep shutting off, so I will kind of just be right here.
That is okay.
So this work is evidence-informed. It is purely based on my lived experience as a Black trans man and the lived experiences of folks that I've interviewed, chatted with, folks that, I've kind of built an alternative advisory board on. And it's really more so me sharing my experience, navigating different systems and different frameworks and sharing my experience. And if folks resonate with what helped me, great. If it doesn't resonate, it's not the end all be all of anything. And so I tell folks, engage at your own risk. This is purely, if it resonates, it resonates. It's not in place of or above anything or anything else. You can go next slide. So this is just a little bit more about my bio. I am honestly a lot of things at this point. A filmmaker, a musician, a humanist, photographer, really just any way that I can tell a story and ethically tell a story. A few years ago, I think it might have been late 2020, early 2021, I was talking with one of my mentors, just saying, like, I have no idea what I want to do. I just feel very lost in my work right now. Like, nothing really makes sense with the current state of the world at that time. And they were saying, just take some time and write down all of the favorite projects you've worked on, who the projects were about, and who you did the projects with. And it boiled down to all of my life work has always revolved around storytelling with Black and Brown folks, and really just being in community and figuring out the most ethical way to tell and uplift a story. So that's led me into many different industries, many different spaces. I'm a musician first. I've been a musician for 20 years this summer. Grew up in and out of bands, was able to work with Grammy artists, was able to study with them, um, and then did some film scoring, and was able to work on some cool movies and TV shows. And yeah, just kind of my life work led me to doing some cool work, which I wouldn't say that the work that I've done defines my life work, basically. Yeah, you can go next slide. And then these are just some people that I've worked with. Also does not define who I am. It's just spaces that I've been in and folks that I've worked with. Some people think it's cool. I think it's kind of cool. But yeah, it is what it is. So I have a nonprofit, and I use the term nonprofit with a grain of salt, because I think for this work and in general, nonprofits are not the answer for a lot of things. Um, I don't think that just the way that they're set up and the reason they're set up don't is not the best structure for the issues that they serve or address. And so nonprofit is really just a tool for sustaining this work currently. But my nonprofit's called Halogen, and it's all about raising suicide awareness for Black and Brown trans communities through art and in turn through viewing the soul. And I wrote a book which I will talk about a little later on in the presentation, but it's all about highlighting the difference between meeting someone's soul versus meeting their physical body. Because I'm a firm believer that the body is just a physical representation of whether the soul is being taken care of or not. So you can learn a lot about a person, like their essence, by their body. You can go next slide. So I started this work back in 2022. I was living on the East Coast at the time, and I didn't really know like what I wanted the work to be specifically, but I just knew that I wanted to work with Black and Brown folks, and still the same storytelling piece. And it started as a docuseries. I got some funding to do the pilot episode and flew to Chicago to do that episode, and was kind of, just working out the logistics of everything, kind of the style that I wanted to go and what was going to be like that through line of the work. And I did the pilot episode, and that's when I got called out to Washington, Ferndale specifically, to direct a documentary about Juneteenth. And had no context of the area, knew very little about Washington, actually knew nothing about Washington, and came out during summer, and I was like, oh, this is great. Like everything, summers here are wonderful. And some other family stuff was going on, and just ended up moving to Ferndale. So moved from New York to Ferndale in 2022, which was the biggest culture shock of my life. And ended up was a janitor for a little bit, and then started working a different job, and then started working at Northwest Youth Services. So Halogen and this specific work took the back burner. And then about September of last year, August, September, just I felt that shift coming in the work at Northwest Youth Services. Like the work is not lining up with my life work, and ended up leaving in October of last year. And I was just like, okay, I'm in a position where I have a little bit of privilege to explore what my work is going to look like, and what do I want to do, and how do I want to honor my life work. And I went back to the drawing board on Halogen. My first thought was, okay, maybe I should turn this into like a proper nonprofit then. And it's like, okay, I need a mission, I need a vision, I need the values. And at that point, it's just like, I have a lot of nonprofit trauma. I just don't think that a mission, vision, values is accessible for me right now. Like, I just don't think I can get the message that I want across in that format. And so I took my notebook to one of my favorite spots and I just started journaling about how I see myself in this work and where I want the work to go and what I want the work to be and how I want the work to interact with folks and how I want folks to build the work as well. And it ended up just writing a manifesto, really talking about realizing that suicide forced me to come face to face with the things I loved most about myself. So, in wanting to end things that I didn't like about myself in that moment or end situations that I didn't like, I realized I'd have to give up an entire lifetime of love for my music and my art and the relationships and friendships that I'm building and all of like the little quirky moments that make life life. And it really, for me, changed my perspective on suicide and really talking about suicide and how it's not just this like late stage crisis management tool. Um, Suicide prevention is in all of those little moments that add up to a lifetime of a person. And it's like, okay, this is really interesting. I'm going to keep writing about this. I'm going to keep exploring this. And I was like, okay, why did I come up, like, why did I call it halogen? I knew there had to be something else about that. And so I started doing some more research and halogens, the literal translation of halogen is salt producer. Salt is the oldest embalming chemical. And also halogens are extremely electronegative. So the smaller the atom, the less distance and stronger ability to attract electrons to it. And I was like, this all makes sense. I was seeing bits and pieces of it, but I had never seen the full picture of my work until about last October. And my whole approach with this work is that if the closer we are to observing the truth of the soul or someone's soul, the more life we can attract to them and start to have those conversations about suicide, suicide awareness, suicide prevention. And it's also by uplifting people, their souls, the essence of them. But just the sheer act of doing that is suicide prevention because you're allowing people to see a person for who they really are, their passions, their visions, their values. And those are all key components in suicide awareness, suicide prevention. So I felt like I didn't know the best way to get that into a mission statement. It's just everything is so story based that I felt the manifesto was the best way to go. And you can go next slide. So what is a life giver? I was at a conference, I don't know, maybe January of last year, and was also going through a tough time and was chatting with a colleague, and she's saying that she calls herself a life giver. And I was like, what do you mean by that? And she's like, well, I just give life. Like, it's not, there's something that happens when I'm in space with people and I don't know energetically what happens, but life is given. And in that conversation of just, talking through what I was going through and just kind of catching up on life, 5 conversations of like work opportunities, decompression opportunities came through in that day. And she's like, I just don't know what it is. Just I give life to people. And so I've always really kept that close and thought about that and tried to implement that into my life. And kind of boiled it down to a life giver is a person who is committed to preserving joy and restoring the ability to dream. This person is curious. They use empathy as a catalyst. It's reflexive, and it's born at the intersection of creation and excavation. So it really is like and I just came from a meeting earlier today where this is going to work on a film with somebody, just trying to identify like what is the through line of the story for the film. And he said, be careful of those who you try to throw away. And I feel like that is the essence of what a life giver is. It's like, it's seeing that person as a person and seeing that person for their visions, their values, their passions, and by seeing that, you're allowing their life to bloom. You can go next slide. So oddly enough, I mean, it happened more when I was living up north, but I get asked a lot why Black and brown trans communities, just all different types of racism completely erases the intersectionality of Black and brown trans communities. I know from personal experience, when I'm in space with folks, it's either, I am in the space as just a Black man, or I'm in the space as just a trans man. But I'm rarely in spaces where I can be my full self of a Black trans man, or like I can really honor all parts of my identity in a space. And I found it really leads to camouflaging, which also just, it further puts me into a state of survival, which makes falling into suicidal thoughts, suicidal ideation that much easier. And constantly being in that state is just, a direct attack on the ability to dream, to access joy, to really even imagine and actualize an autonomous life or find meaningful work and really dream. Because if I can't rest, I can't dream. And if I can't dream, I can't tell you what I need. So that's why I chose Black and brown trans communities. And I think that's also very evident just by what's happening today with that orange man. You can go next slide. These are from, what does that say? 2024 Trevor Project survey. And you can see, these numbers are also kind of difficult to get down into the nitty gritty of things because they are vast. But you can see on just overall, 27% of cisgender men considered suicide in the past year versus 47% transgender women and 52% transgender men. And then attempted is for cisgender, 7%, trans, both men and women, 14% and 18%, which, it doesn't really get into the racial demographics of this, but you can see the clear difference in the numbers, which is alarming all by itself. And historically and notably now, all of these resources for trans folks, and even more so Black and brown trans folks, have been systemically obstructed and diminished. So Halogen, and what I'm trying to do and doing through this work, is really continuing this advocacy from the person first lens. So making it as thoughtful, as growth focused as possible, and making sure that I'm always prioritizing the safety and empowerment of Black and brown trans communities. You can go next slide. Yeah, so now you can see, which still doesn't get as specific as I'd like, but it still gives a pretty clear picture of like the differences between all of these, where the need is and what story is being told and what's happening and who's not being taken care of and who's being neglected. Yeah, you can go next slide. So the initial activity, when I wrote a book, that's that's the first activity, is when I was writing the manifesto and really shifting to the focus on the soul, I was very curious to know like if other people felt the way I felt, of kind of zooming out and viewing my life as a spectator. And a lot of folks said yes. I think there was just, we all have different language around it of describing what we're feeling or how we're viewing our lives and how we're viewing things. But I just started asking folks, I was like, do you, like, what part of what makes you get out of bed in the morning, like, where does that live in your body? Or like, what part of you is that? And in one way or another, a lot of folks alluded to the soul. And I was like, okay, very like interesting. I want to explore this more, and I want to just see where this takes me. And so I started really thinking backwards in a way of what if I go out and I learn about different beliefs around death and the soul and kind of start to remove the polarities of life and death? Could that be an in to suicide prevention or suicide awareness? And it turns out it is. I mean, I definitely want to continue it, but yeah. So the what I did was I traveled across the U.S. and then worked with folks outside of the U.S. over Zoom to interview them about how they view their soul, how they view death, um, and how they honor themselves, how they honor their lives. And what I did was I asked them like what sort of things represent your soul, and I photographed those things to say like this conversation and this connection to yourself, not it doesn't just live in language, it lives in objects, it lives in energy, it lives like basically anything that you can dream or touch in whatever sense is an extension of your soul. So I started that back in, man, what was that? I think I started interviewing folks in January. You can go next slide. So I also did a little bit of preliminary research, mostly around like philosophically, what is the soul? And boil it down to the soul is made up of three parts: growth, maturity, decay, and death is a process of decay. And it's through growth and maturity that we learn about decay. And also realizing that the soul is the both the origin and the end of movement. So like it says, like everything, it starts with the soul and it ends with the soul. But I don't believe anything truly ends. It just takes a different a different form. And so I was like, okay, let's start researching how different cultures and different parts of the world view death and the soul. And of course, in the States, it's a lot of it is tied to religion, but it's kind of saying that death is kind of the end of everything, and once you die, it's lights out and the big decision, or whatever you want to call it. And then you go outside of the States and you go, you know, some like West African cultures, anywhere else, like death is just a different age group, or it is the next stage of life, or like, it's the ancestor age. So it's very interesting to see like death does not have to be, it can be any sort of determiner that you want it to be. And you can go next slide. So this is the book. It's called Gravity is a Concentration of Understandings, and it features 28 interviews of the folks that I interviewed. So it's transcripts. And I'd been studying with Dr. Rachel Chapman at UW, the anthropology professor, on some other projects. And I was just saying, like, I want to do these interviews, but I want to make the interviews like not your typical, just like I said this, they said that. And so I worked with her to kind of like learn how she does transcription and really make sure that it is like person first and human based transcription. And so the transcripts are like obviously what we said, but I took notes on, let's say whoever I'm interviewing like shifted their body language, or we're in an interview and there is like a noise or something happens and we both have a reaction to it, of documenting everything that happens in that conversation. So it feels like whenever you read that transcript, it feels like you are in the room during the interview and capturing all that energy. But I asked folks about 10 questions, really just saying, how do you describe your soul? What does it feel like if you've ever felt like it? If you're like, what does it feel like if your soul is separate from your physical body? And the last question I asked folks, which is one of my favorite parts, is if you could leave a message for your soul, past, present, or future, what would your message be? And so it's a little like nugget for folks to take with them if they resonate with that person that I interviewed. That, you know, whenever they're out, like I had somebody say, elephants really represent their soul. So it's like anytime I see a picture of an elephant, I think about that person, I think about that interview, I think about that experience. So a way to really just get folks oriented to the energy around them. Next slide, please. So this is also just talking about that content. And then after interviews and really in creating this new version of the work, I would journal a lot of just how I'm feeling, how it's been for me in my own suicide prevention journey to do this work and to kind of have pieces of my soul attached to other folks and have their pieces of their soul attached to mine. So it's the interviews and then just some journal entries and some reflection pieces about my journey in this work and how it's really shaped me and been monumental in my suicide prevention journey as well. Next slide, please. So the book goes, I have not like organization partners, and they consist of therapist offices, other nonprofits, community organizations, really places that serve primarily Black and brown trans communities or have like good connections and good relationships. And these are a couple of them: Therapy Fund Foundation, which is based in Seattle, Whatcom Family and Community Network, Transwa, which serves all of Washington, Compass Health, and Eliza's House, which is in Maryland. And this list is continuing to build, and there are many more partners now. But it's all about the same thing of like the disclaimer in the beginning is like, this is a very personal experience. And it's not like, take this resource and tell people to read it. It's kind of like anybody who has agreed to be a partner has viewed the content. They know what they're getting into. Just like, this is an experience, it's a recommendation, and it's a resource that is available, and it's not, you know, obligated to be implemented, which has also been really cool to have folks be so interested in this work and kind of curious about, you know, what does it look like to break down stigma around suicide and talk about it in different ways and take this approach. And I'm hoping to next year start implementing, doing some like collaborative networking and brainstorming through partner convening. So having everybody come together and continue to do trainings for folks if they want to learn more about like how I define life giver, or if folks wanted to do projects like this, like if an organization said, hey, I want to do a project like the book, like I would more than happily come in and consult and saying like, well, this is how I put together this research project. This is how I decided how to do this. If that is healing for folks, if you know, folks want to do their own project and their own continuation of their journey. And then next slide, please. So the book in public. The book is for sale, and all of the proceeds from that book go back into making sure that, you know, partners have copies, the work can continue, goes back into operation costs, basically just a way to further support the work and keep it sustainable as grants become more and more difficult to access and obtain. And just for folks that are, you know, also looking to expand their view, whether that's through allyship, through just general curiosity. And I tell folks like, this book is not, and this work, the book and the work is not just for Black and brown trans communities, because I think there is a lot that folks can take from the book and can be applied to any area of life. But the focus is Black and brown trans communities. But I do believe that everybody can learn something from the book. Next slide, please. So the next program I am implementing, which it's taken longer than I want, just due to the government and the current state of things. But the program is all around building health equity and health literacy. So really talking about the effects of testosterone and estrogen therapy on red blood cell count, blood pressure, and genital tissue in mostly Black trans communities, but it applies to Black and brown trans communities. Really just saying that, you know, the research shows that Black Americans are the least insured in their early 20s, and that's when a lot of folks start to transition. And also, there is really no like comprehensive sex education or really anything bodily autonomy based for Black folks, especially Black trans folks, trans and queer folks. And so and you go years and years of not really knowing what, like, how to care for your body unless someone teaches you or you have access to that information. And obviously having access to that and being able to be in good health is another key in suicide prevention. The one thing that really sparked this program is that when trans men start taking testosterone, we go through menopause, which we already know menopause is not talked about enough as is. And, you know, you start bleeding, walls are thinner, especially if you're having sex with cis men. There is an increased risk of HIV, STDs, STIs. So it's like all of these places where folks could be, you know, accessing information, accessing care, they're not, which can lead to a devastating diagnosis, which could add to suicidal thoughts, suicidal ideation. So it's really saying, you know, all of these issues do not exist in silos. They're all connected. And if you approach it from the human first approach, you can touch on all of these things that affect one person. Yeah, so the program would be to create a patient empowerment guide of just saying, you know, folks could see this and say, I am this, I'm taking this medication, here are tests that I can ask my doctor about, here are general things that I can look for or look out for, the questions I can have about my family history, all these things to make sure that folks are safe, healthy, and accessing the care that they need and can be as informed as possible to hopefully prevent. Yeah, unfortunately, folks will experience some level of racism in the medical system, but hopefully making sure that folks are as informed as possible to stand up to doctors to really advocate for themselves and advocate for their health. You can go next slide. Yeah, so this, some partners in this work, Washington State Syndemic Planet Group, Snohomish County Health Department, Providence Hospital, and the UW network of underrepresented residents and fellows. And this is also having more partners expand as we navigate grant funding. Next slide, please. So again, Halogen is not guaranteed sponsored clinical or certified suicide prevention resources. Since it's not legal, financial, or medical or professional advice. And importantly, it is definitely not the end all be all of suicide. It is, I think I put it in the description too, but I view suicide as a like multi-area reduced access to the self. So it's looking at school, it's looking at hobbies, it's looking at healthcare, it's looking at public transportation, it's looking at city planning, it's looking at everything. So the end all be all is a hefty answer or topic to tackle. So Halogen is definitely not that. It is the just more person first, uplifting the person. Next slide, please. Yeah, so Halogen is a way to start conversations around breaking down the stigmas of suicide and suicide awareness. Emphasize that suicide prevention specifically is not a late stage crisis management tool. And really saying that it is in all of the soft moments or little moments that add up to a lifetime of a person. So, me getting coffee from my favorite coffee shop, me hanging out with friends, me maybe not going to dinner with certain people, or having dinner with certain people, or investing in an online course, or it's really whatever folks deem affirms them and affirms their life. That is suicide prevention, I believe. And Halogen is really highlighting the softness, emotiveness, and sweeping genuineness of Black and Brown trans communities, on top of trans folks being demonized and criminalized and casted in a horrific light. We still have the ongoing racism, the ongoing stigma, the ongoing just perception that Black and Brown folks are violent. So it's really just saying, like, really uplifting the humanness and seeing a person first and realizing that everybody is complex, everybody is multi-layered, and we have to start viewing people for humanness first before anything else. And I also feel, through my work and definitely through the pandemic of just like things seem to only be getting crazier, is I feel the most belonged when I can be a viewer and engager of the soul. So I feel the most belonged when I'm in community with folks, when I'm able to really like share the joy that I get from doing what I love rather than trying to just share joy for the sake of sharing joy. Yeah, so really to be an effective change maker, I must take care of myself. And through this work, I am also able to take care of myself and really practice what I preach and also preach what I practice. Yeah, and so if I really had to sum it up, of what Halogen is, it's really a way to create more life givers by empowering people to dive in deeper with their loved ones, their friends, strangers, colleagues, whoever, and to view their soul first rather than their body. And go last slide. Yeah, so Halogen is fiscally sponsored by Chuck Nut Health Foundation, which allows me to use the tools of a nonprofit. Yeah, and I think that the QR code will take you to the website. But yeah, thank you for allowing me to present and share a little bit about what's important to me and my life work. And also, I just love talking about what I'm passionate about. So thank you.
Thank you so much, Remy. That was wonderful. And I want to open it up to folks with any questions, comments, anything that you'd like to share or ask Remy.
I just wanted to say I really enjoyed the call to action to explore the depth of your relationships with people and like go beyond just the surface in like the day-to-day, and how that is an act of suicide prevention and how being genuine is like, yeah, that really enjoyed that.
Yeah, well, thank you. I appreciate that. Yeah, I forgot to say it. So in response to everything that's going on, I started offering free 1-hour photo shoots to Black and Brown trans and gender diverse folks in the Seattle area and surrounding areas. And in that space, I also talk about Halogen and like straight up just ask folks like, have you ever considered suicide? Just like a little mental health first aid of just getting in the habit of straight up asking folks and making sure folks know that they can reach out and they can talk about it. Yeah, and it's like it's definitely not easy to dive in deep, but yeah, I appreciate that.
Remy, thanks so much for being here to present and for sharing your heart the way that you have. I wanted to ask you about if there are trans kids in our lives that we could, like, how do we connect them with you or with spaces that that you recommend?
Yeah, absolutely. I'd say there's contact info on the website, which I can also pop in the chat. I would say that I'm a certified mental health first aider. I think what I would do is definitely more on like the evidence informed side. So being very clear about like, I don't have any certs as a therapist or anything, but in terms of just being in space with folks and chatting with folks and just kind of getting to know them, I would love to do that. I'm putting together a guide of some things. Are you wanting stuff that is local to kind of the Seattle, Snohomish area, or could it be really anywhere?
Washington State is pretty good at this point because, like, you know, I know of folks that are having to, especially for seeking state resources around civil rights and that kind of thing. Statewide is really beneficial. Thank you.
Yeah, absolutely. I can put a list together of things that I've seen or things that I've interacted with and hopefully get that to you one way or another.
Thank you. That's wonderful.
Yeah, of course.
Great. Well, Remy, thank you again so much for sharing your time and your story and your expertise with us. It's been wonderful.
Yeah, of course. And thank you for having me.
Absolutely.